My name is Robert James Caponegro, MD. I graduated from medical school, Creighton University, School of Medicine, 1958, June 4th, 1958. I really remember the date. I then, after that, I had 7 years of training, 1 year of internship, 3 years of general surgery training, and 3 years of urologic surgical training. From there, starting in 1965, I went into private practice of medicine, which which was urological surgery, for about 42 years, and I'm retired now, about a year and a half, unfortunately, but I certainly enjoy every minute of it. I'm board certified in urology. I'm a fellow of the American College of Surgeons. I was, for a few years, a assistant clinical professor of surgery, downstate medical school, and I was chief of urology for many years at St. John's Queen's Hospital and the Catholic Medical Center.
Thank you. It's often said that positive thinking can help a person heal and negative thinking can slow the process. Do you believe that a person's attitude or perception of their disease affects their chances of recovery?
Well, I think that is a very good question. And it's a question very often asked and trying to evaluate. I certainly believe that positive thinking makes a big difference in the patient's care and how the patient does do the care. A patient who has a positive attitude is, although they have illness and so on, they're much more upbeat. They're much more cooperative with the healthcare plan. They're much more faithful to taking their medications, to keeping their appointments. They're happier people as well. Whereas the poor attitude, you can spot it right away. A patient is more depressed, sometimes to the point of despair, in the extreme, and they don't keep as faithful to their appointments, to their medicines. They don't just seem to care anymore. They're unhappier, and they do tend to do worse.
Have you ever had an experience with a patient where it mattered?
Well, yes. Every patient that comes in has a mixture of these two attitudes. And again, it's just an overall general observation, and just for myself and for other physicians, that the positive attitude does make a difference, sometimes a large difference, where the poor attitude, they just don't seem to do as well. And even no matter what the outcome is, as I say, I think the positive attitude is a much more happier person, than the one that's constantly depressed and discouraged and just doesn't seem to care anymore.
Can a person think themselves sick?
Excuse me?
Can a person think themselves sick?
Absolutely. I think there's no question about this. And the reason is that the mind is so powerful that it can cause physiologic changes. For instance, just take what they call a flight or fight reaction. This is what happens when you suddenly get scared. The trolley car almost hit you. What happens? The heart starts beating fast, the blood pressure goes up. You have all these physiologic changes ready for fight or for flight. And all this is almost instantly occurs because of the mind control. And this can be a chronic thing. You always hear of people who have chronic ulcers and high blood pressure, and mostly from a chronic stress in their lives. And you tend to see this, and there's a definite correlation between them. See, the patient is really two parts. Any human being is. First of all is the body, with all its physiology and so on. And the other is the mind, the persona, the soul, which is very powerful. Both of them are very powerful. And the health of each part is the ideal for good overall general health.
There is some documented evidence that some alternative medicine has helped alleviate symptoms of diseases. Do you believe that alternative medicine works because a person perceived it to be helpful, or can it be a real cure?
Another very good question. This is always, patient, I'm sick. What should I do? Where should I go to? Who should I listen to? Who has most of the answers? Who doesn't? Alternate medical care is outside the realm of the general, to a large extent, to the Western medicine, but not completely. There are elements of it that have already been incorporated into what we call the standard scientific Western medicine. The problem is that there are so many alternate types of medical care, ranging from complete quackery and charlatanism to some that really do have merit in their own particular sphere, maybe limited, but in their own particular sphere. Acupuncture, for instance, would be an example. But alternate medicine goes beyond that. There are alternate medicine types, like Indian medicine, traditional Chinese medicine, that sort of thing. And then you start going from things that you'll keep hearing: reflexology, diet, therapy, etc., and many different kinds that are sometimes very difficult to evaluate. And the patient who's sick is grasping at anything that he thinks will help. And it's very hard for him sometimes to be able to evaluate it. I mean, because they go, oh, you're a reflexology, you know, they're at dinner, well, tell me I have this problem. Well, oh, yes, we'll take care of it, you know. And I think it's incumbent when they are sick and to speak to their regular doctor as well if they have any questions. And of course, today, with all the medical information out there, you can Google it. You can Google this and get the information, get their evaluation. And it's not just either or. There's something also called complementary alternate medicine. And that means a combination of both, where you have the traditional Western practice of medicine, care, and some of the best parts of alternate medicine. So again, there's this wide spectrum, but one must be very careful. I think most doctors are seeing more and more that alternative medicine does have some very good points. Again, if carefully evaluated, and especially their limitations, and to the fact that they would tell a patient, well, don't go to alternative medicine completely and ignore the standard medicine, which has a track record over the centuries. Maybe it doesn't cure everything, it certainly doesn't, but